Good afternoon, ma. Good afternoon, ma.
Good afternoon.
Can we meet you?
I'm fine, thank you.
Can we meet you?
Can you meet me? I'm
Yes.
Dr. Osuo.
Why are you here today?
We came here to give a talk on sexual abuse, to address the young women, even the adults, with sexual abuse.
It's okay.
The telltale signs to look out for in children and the complications that might follow afterwards. And to seek help if there's a need to, and not keep quiet about it. Suffer in silence. So that's why we came to.
Okay. What's your cry to the government? From what you've seen?
From what I've seen, yes, a place has been provided for these displaced people. But a lot more needs to be done, sanitary-wise. If you could just go around and see. Yes, we provided a place, but the sanitation here is really poor. And health is wealth. We are trying to give these people shelter, but if we don't look after the health aspect of it, then we are not really doing what should be done. So that is my vibe. A place has been provided, but it should please let us work on the sanitation.
It's okay. Thank you so much. Thank you. Good afternoon.
Good afternoon.
Can we meet you?
Okay, I'm Dr. Olije Wakdok.
You came out to support Maureen.
Yes, I did.
How do you feel?
It's really encouraging, and it gives hope that young people care about the future of our country, care about people that are less privileged and are ready to give their time and support to that. It's very encouraging and it's admirable.
She's young. She has nothing. What would you tell the government or people out there to do to her to move this vision forward?
I think when we see young people with a vision, ready to change their environment or contribute meaningfully, we should support them. I think working together, there are so many organizations that offer aid to less privileged people, but there's no synchrony, and so a lot of times people come and do multiplicity of functions, but you have someone that has, like for her, Demystify Abuse offers mental health support and encouragement to people that have been abused. You have organizations that take care of food, you have organizations that take care of health needs. If everybody is working together, the same funds that are used to support either any of these projects pulled together, so it's offered as a compact parcel, that everything comes together. I think it will even help instead of people walking out of pocket, because sustainability is very important. We have to have a system, a structure in place that we key into. And for IDP camps, the health needs cannot be underemphasized, especially the mental health needs, because these people are vulnerable, and because they are vulnerable, people prey on that and push them or take advantage of them so that they can offer maybe material comfort for a while or food and all that, and because of that, maybe out of frustration, out of hopelessness, they give in. So we need to be able to equip these people. Prevention is better than cure, so that they are aware that this could happen, and they are aware when they are being in a situation where they can be abused. So it's very, very important, and I think that the government should support such ventures. There should be a system for keying into if you have ideas that can be beneficial. Young people volunteering their time and their resources, I think they should be encouraged with some government support. And I think most importantly, we should synchronize all our aid plans together instead of doing it in bits. It spends more resources, and I think the outcome will be better, will be more effective if everything is synchronized, so that we offer a package together that takes care of all the needs, be it sanitary, health-wise, educational, whatever the needs of the people that are at risk. I think we should synchronize it together, and so that we offer a package together and people can key into that. So I think people like Maureen should have where they can go to and not try and do things themselves, so that even when she's not there, there's a system in place to continue this care, because if we come here and we offer this care and then the people leave and we leave, and there are people that are encouraged today to seek help, where do they go to? Do they start calling her in Port Harcourt? You know, there has to be a structure in place, and I think this is one aspect the government needs to look into, because better health for everybody, a healthy nation, it's a happy nation.
It's okay.
Thank you.
Thank you for supporting Maureen.
You're welcome.
God bless you.
Thank you.
Good afternoon, sir.
Good afternoon.
Yeah. Can we meet you, sir?
Okay, my name is Samuel. I'm a clinical psychologist.
My pleasure, sir. I saw you in there interpreting. How do you feel?
Well, actually, giving a talk on demystifying sexual abuse.
Okay.
You know, in an area like this, in a setting like this, the tendency for sexual abuse cases to go unnoticed is also very high. But there are certain salient points and certain salient signs that can be observed. So, in order to try to curtail the consequences of sexual abuse, I think there is need for us to also support what the convener of this outreach is doing to help her to also bring our own bit to curtailing that.
Okay. From what you've seen today, what other aspects do you think should be brought into this camp?
Well, I mean, it's first of all good that there's a camp here to, you know, provide shelter for those who need it, those who are coming from those who are displaced. If you look at the hierarchy of needs, shelter has been provided. What about food? What about the environment as it is? It's not just the shelter, but the environment. Again, you know that in a place like this, the culture of drugs, substance use can also be very high if not properly monitored. Some people can start, you know, developing a trade in substance, in selling and buying different psychoactive substance. So that's also something that should be taken into cognizance.
It's okay. Thank you so much. Thank you, sir.